My name is Cassandra Grace Perez, and this is my presentation on gas gangrene. Chapter 1, Introduction. On December 29, 1972, 176 people aboard Eastern Air Flight 401 were flying home amidst the winter holidays. Their destination? Miami, Florida. Little did they know on that ill-fated flight, distracted pilots trying to change a faulty light bulb would be the reason some would never make it home. At 9:20 p.m. EST, Eastern Air Flight 401 would crash land in the Florida Everglades, killing 101 passengers and crew alike. 75 passengers were accounted for. In any normal situation, many more would have bled out and died awaiting rescue in the cold, bitter night. But this was anything but. Wounds were packed with the thick mud of the Everglades, which prevented blood loss, but it came with a much more unknown price. 8 out of the 75 passengers, including Ron Infantino, had been infected with gas gangrene. Now, what is gas gangrene? Gas gangrene, also known as clostridial myonecrosis, is the gaseous buildup of nitrogen and necrosis of tissue, specifically muscular tissue. Caused by Clostridium perfringens entering a wound, this bacteria is found in organic matter, which is pretty much everywhere. Chapter 2, Disease Info. In the U.S., there are about 1 in 100,000 adults who contract gas gangrene. Its prevalence rate clocks in at about 3,000 infections per 3 million adults in the U.S. alone. In other countries, the rate of incidence is unknown, but is of course higher in less developed areas. Those who catch it early and treat it to the best possible degree have around a 20 to 30% chance of death, but this rate more than doubles at a whopping 67% if the patient is immunocompromised. Since it's so prevalent in our natural world, in soil, rotting veggies, fecal matter, and even our gastrointestinal microflora, there's no set season where people contract gas gangrene. Although correlation doesn't indicate causation, it's most common in men aged 25 to 49. Untreated, gas gangrene will kill a patient 100% of the time. C. perfringens will enter a wound through sporulation, so gas gangrene itself can be found anywhere there is a wound on the body. A common way of contracting the disease is accidental inoculation via surgeries involving the GI tract, which houses the bacteria. It's more common to contract on the extremities. Symptoms may include fever, trachycardia, which is rapid heartbeat, jaundice, yellowing of the skin and eyes because of damage to the liver, and hypotension, which is low blood pressure. The patient may experience intense pain and numbness at the site of the infection, alongside chills, confusion, lightheadedness, and shortness of breath. The infected skin will be swollen and dark purple in color, accompanied by pus-filled blisters that smell sweet yet foul. The pus itself is said to look like dirty dishwater. C. perfringens will exit the body via these rotting tissues in order to create more infection. If left untreated, the bacteria will continue to ravage the body and cause renal failure, sepsis, and eventually death. In order to prevent gas gangrene from occurring, healthcare professionals will clean out the wound as well as practice sanitary and sterile conditions for the patient. If infected, seek medical assistance as soon as possible. They will remove any necrotic tissue as well as any associated bodies, and from there you are presented with 2 options: total amputation of the limb or hyperbaric oxygen therapy. Hyperbaric oxygen therapy is simply breathing in pure oxygen in a pressurized setting. In turn, this creates free oxygen radicals to denature proteins in the cellular membrane as well as intracellular components. This is then paired with a concoction of penicillin G and clindamycin. Penicillin is responsible for cell lysis in gram-positive bacteria via inhibition of peptoglycan production. For those allergic to penicillin, Doctors will instead use cephalosporins, clindamycin, or chloramphenicol. Chapter 3. Bacteria Information. Clostridium perfringens is a spore-producing, non-enveloped, gram-positive bacterium in the bacillus shape. It has 4 categories based on the toxins produced. This includes alpha, beta, epsilon, and iota toxins. Its genome measures to a high 2 million to a low 3 million base pairs long, and it has a low cytosine guanine content at 28.6%. It is anaerobic and has no genes for the citric acid cycle or its proteins. Instead, the pyruvate derived from fructose, galactose, glycogen, maltose, mannose, raffinose, starch, and glucose is converted to lactate, alcohol, acetate, butyrate, and hydrogen gas. It contains 45 genes for amino acid synthesis and 61 genes for sporulation and germination. It's enabled to grow where amino acids are limited. C. perfringens produce 17 different toxins, the most virulent ones being alpha toxins, beta toxins, iota toxins, and epsilon toxins. Alpha toxins break down the cell membrane and promotes necrosis of the cell. Beta and iota toxins induce necrosis, and epsilon toxins increase cell permeability. Collagenase destroys connective tissue to allow for deeper infection, and the PCW3 plasmid provides antibiotic resistance. Through the combined enzymes and toxins, C. perfringens is able to metabolize the nutrients of the muscle